This is a special report from News 3 WSIL.
Hello again, I'm Julie Williams. We continue our COVID conversations tonight. We're getting into the impacts COVID-19 has had on you, our viewers. For tonight's conversation, I'll turn it over to my co-anchor, Mark Kiesling.
Thank you, Julie. We're joined tonight by Dr. Junaid Haroon, a cardiothoracic surgeon at SIH. Thank you for joining us tonight.
Thank you for having me.
Now, let me ask you to start off with, as a cardiothoracic surgeon, what type of procedures do you do?
So I primarily deal with surgeries on the heart and the lungs. So heart surgeries like bypass operations and valve surgeries, and then lung operations, mostly dealing with lung cancer and taking portions of the lung out that may develop cancer in them.
Okay. And what should heart patients know before, or are they, let's start off with, are they more at risk for severe cases of COVID-19?
I believe they are. The heart is such a central part of the body that any kind of added stress, from climbing a flight of stairs to battling a severe viral illness like COVID, can really put your heart at added stress and use all the extra resources that your heart has. Now, people with heart disease, they of course don't have all the extra reserve in their heart. So when they're put in a stressful situation like a severe COVID illness, they can really struggle and unfortunately have worse outcomes than younger, healthier people.
Are there some things that heart patients need to know before getting the COVID-19 vaccine?
I think the most important thing for them to know is not only that the COVID vaccine is safe for heart patients, but rather it's critical that anybody with serious heart conditions get the COVID vaccine. And that's primarily because, if you don't get the vaccine, you get a severe case of the illness, you're at a much higher risk of doing poorly and having more complications, being in the ICU, on the ventilator, and possibly even dying as a result of COVID.
And I assume that holds true with pulmonary patients as well.
Very much so. Again, COVID primarily is a pulmonary disease, so people who already have compromised lungs, of course, struggle a lot more, end up on the ventilator. And once they are on the ventilator in higher settings, and again, it kind of spirals downhill. The more you struggle, the worse your outcomes are going to be.
What are you seeing in terms of the demands on critical care hospital employees and providing inpatient COVID care?
It's a very unfortunate situation in the hospital. Now, I come from a third world country, so I've seen how healthcare is a limited resource back home. That's not something we imagine or think about very much here in the US, being a first world country and a world leader, but we have come to that point where all our resources, manpower, nurses, hospital beds are struggling to keep up with all the sick patients, one, who are coming in, and two, the ones who are already sick are really staying in the hospital for weeks, just struggling and trying to recover. It's not a quick process, so it really takes over a lot of the resources, and very, very rapidly, our healthcare is also becoming a limited resource, and we're trying to have to pick and choose how to utilize it.
We're also seeing that care for COVID-19 patients is also limiting opportunities for other patients who may need elective surgery. What are you seeing when it comes to having to put off some of those elective surgeries? How is that affecting patients?
I think we're in a really tough spot when it comes to that kind of situation. I primarily deal with people who have severe heart disease and lung cancer. Both of those situations, you don't really want to delay care if at all possible. You want to get the patients to the operating room, get them the care that they need as fast as possible, because you really don't know what's going to happen in the next day, next week, next month. Unfortunately, with the ICUs being completely full, us not having any nurses, we are having to put off any case that we possibly can. And even the ones that we feel like we cannot put off, a lot of times we'll call the hospital supervisors and try to find out if we have ICU resources available to take care of them. And many a times we don't. And then we have to figure out how to take care of that patient. So I'll give you some examples. We've had people who needed bypass surgery for their heart disease, and we didn't have available ICU beds. So we had to either send some of them out to another hospital, which is less than ideal for people who live locally. It's a big commute for their families, and it's a big stress on them being away from home. Or we had to pick stenting over bypass, even though medically bypass was clearly the better option for them. So we're choosing an inferior treatment option for them because of the limited resources.
So just to clarify for our viewers, when we talk about delaying elective procedures, we're not talking about something that somebody just wants. It's needed surgery, but it's maybe a surgery that, well, we just can't do right now, but it doesn't mean that it's not something you can put off for months or a year.
Yeah, oh yeah, medically, elective surgery is anything that can wait more than 24 hours. So if you come in with a heart attack and we decide your chest pain's taken care of with medications and we'll plan to operate on you tomorrow or the day after once your heart's had a chance to recover, from a medical standpoint, that qualifies as an elective operation. And I understand that's very misleading to the general population, but that's just, semantics really. And the surgeries we're delaying, most of them are required and most of them need to be done in a timely fashion for those patients to do well.
I think some people, when they hear that term, they think unimportant surgery, but they are very important.
Very much so.
And what's the impact on these delays? How does that affect these patients?
Well, I'll talk to you about my patient population. So people who have severe coronary artery disease, delaying their surgeries puts them at a higher risk of having heart attacks while they wait. Their heart muscles could get weak over time, meaning they're going to struggle in the future, and meaning that they may never recover as well as they would have if we would have taken care of them. Talking about lung cancer patients, you never know when cancer is going to spread, and that's why we try to get the cancer out as early as possible. Delaying their care can tip them over the edge and get them to a point where the cancer is already spread by the time we can get them to the OR, meaning that they're in an advanced stage now and we can't cure them with surgery alone.
So the less resources we're being forced to put towards COVID-19, the more resources we can put towards these types of patients for the surgeries that they need.
Exactly. Going back to the same point, healthcare at this point is a limited resource. We only have so much we can give in terms of manpower, in terms of hospital bed, in terms of infrastructure. So there's only one pie. You can only cut it so many ways. So if you're putting all your resources into COVID patients, you don't have much left for anybody else. And if our COVID patient population went down, we would have more resources available to treat the other patients who also need the health care.
Now, you're seeing patients who have survived a bout of COVID or a lengthy hospitalization. What does it look like for them going forward?
Well, I think we're still pretty early in our post-COVID data, but I do have a very strong nagging feeling seeing patients, how they struggle in the hospital, how much inflammation they get in their lungs, and a lot of them actually have other organ systems that are affected. I do worry that in the long term, all this inflammation that they have struggled, and luckily some of them have made it through, they're going to have long-lasting effects, and their lungs are not going to recover completely, and they may struggle, which becomes a much bigger issue with the younger population that's getting affected by the most recent Delta strain, because the previous strain seemed to affect older patients a lot more, but with the Delta strain, we're getting a lot younger patients in their 20s, 30s, 40s who are still struggling in the hospitals for weeks on end, and they have few decades at least of productive life ahead of them, and it bothers me to think, if they end up debilitated from after effects of this illness, how that's going to affect them individually and our community as a whole.
And we had the booster shot out now for Pfizer. Do you recommend that to your patients who are 65 or older, that they get that booster shot?
I do. Let me preface that by saying that both of my parents, who are in their 60s, have had the vaccine and they've also had the booster shot. I mean, they did ask me and I recommended it to them. So same goes for all of my patients. I would say definitely get it, because a vaccine's only as good as the immune response it generates in your body. So the data right now says that the booster helps kind of build up that immune response that is starting to wane off from the first couple of doses, and keeps that immune system primed to react to the COVID exposure when you might have it, and minimizes the risk of, one, you getting COVID, and two, you getting a severe illness if you do end up with COVID.
All right, Dr. Haroon, thank you for joining us tonight for our COVID conversation. We appreciate you making the trip over.
Thank you so much for having me.
We will have this conversation and much more COVID-19 information on our website, WSILTV.com.